Hello friends, for next couple of minutes we will be discussing a very interesting topic, that is Takotsubo cardiomyopathy. Takotsubo is a small necked vessel used to trap octopus in Japan. So this disease was first described in Japan and is now increasingly recognized everywhere. Takotsubo cardiomyopathy is primarily a disease of elderly females, but it can occur in males also, and after emotional or physical stress which is of severe nature, the patient presents with hypotension, chest pain, ventricular arrhythmias, or even ST elevation myocardial infarction. Now, the reason for this presentation is that there is an inhomogeneous autonomic myocardial innervation. So, a part of the heart contracts in response to the sympathetic activation, and the other part just undergoes a dilatation. So here the base of the heart contracts, so it becomes smaller in size, and the apical portion that balloons out because of dilatation. So this is the reason this is also called apical ballooning syndrome. Now, since there is increased amount of catecholamines, they produce the small vessel spasm. So the coronary artery blood supply also diminishes to the myocardium. Now, there is also direct myocardial toxicity because of the increased catecholamine. So there are multiple reasons for this presentation, and ultimately this leads on to pulmonary edema, and that's the reason it's called cardiomyopathy. This is primarily the disease of the muscle. This can present with hypotension, chest pain, and ventricular arrhythmias. Very important part is that this coronary artery disease, which occurs because of the spasm, because of the intense myocardial, because of the intense catecholamine release, this does not conform to a particular territory. It's not that the territory of LAD or circumflex or RCA is affected. There is a diffuse change which occurs. So that's the reason the coronary angiography may be normal. The coronary angiography is sometimes required in these circumstances to rule out coronary artery disease. And from the treatment side, nitrates are very useful for prevention of the treatment of pulmonary edema, and also the diuretics, intra-aortic balloon pump for hemodynamic support, and the combined alpha and beta blockade is required if the patient is hemodynamically stable. Now, as there is increased activity of these catecholamines, this leads on to the prolongation of QT syndrome and can produce the ventricular arrhythmia, which can prove fatal. So magnesium is useful under these circumstances. Anticoagulants are generally avoided in view of the occasional ventricular rupture which can occur because of the basal spasm and apical dilatation. So for the treatment of low output, intra-aortic balloon pump support is also helpful, and the magnesium is given for the arrhythmias because of the QT prolongation, and nitrates and diuretics for the pulmonary edema.